Now we're ready.
Okay. I'd like to welcome everybody to our study session of the county board. And the first order of business is public comment. I'd like to remind the audience that we allowed 5 minutes to each person who would like to share with the board their thoughts. So we would ask you to come up here, and we're open to public comments.
We gotta come up there.
I'd prefer, yes. That way you can be on camera, John.
So it's not a mandate?
No, I mean, it's not, I'm asking.
Can
Okay?
I sit down?
No, yeah, you can, whatever.
So, I called you here today, just kidding. I've said this before, and I just wanna say it one more time. Before you vote or make any decisions on who is going to be the ambulance provider for the special service area, I just want you to, and some of you weren't here at the time, probably most of you weren't, but remember the complete disaster that was occurring when the hospital had, and not the current hospital, I know they've sold to, or been bought by a different company or whatever, it was a complete disaster that was involved with the hospital the last time they were in charge of the ambulance service, and everything that happened after that, until the current owner of the ambulance. It was ridiculous, and I hope we learn from our mistakes. Thanks.
Other comments?
Everybody's feeling froggy. Morning, sir.
Good morning, Mr. Allen.
In regards to the ambulance, I've got several things I'd like to dive into. I know I'm on the clock, so I would urge some folks to take a hard look at what's going on in Effingham County in their recent issue to go to 2 ambulances. They're currently in federal court over some of the decisions that have been made because of patient care. Without diving into the economics of it, think long and hard about what happens when you take the current tax levy out of the marketplace. That will have an economic impact across the board. I see there's positives and negatives to both sides of it, but back to patient care. In 2011, this is report number 15718. This was recently published in the Association of Healthcare Journalists. It goes through extensive patient care, identified patient care deficiencies within the Paris Hospital. Failure to ensure patients presenting to the emergency room receive appropriate medical screening. And I'll leave this report with the board, and I would encourage everybody to read it, because patient care is one of the most important things that we're in the business of when it comes to running an ambulance. All of these findings were confirmed. Again, this is an official report, and I'll leave it with the board. But bottom line was, this wasn't a one-off situation. This report contains 4 separate incidences of 13 checked of patient care concerns and assessments. The most recent one was in 2017, virtually the same thing, patient assessments and things that were not done that were supposed to be done. When we look at lowest responsible bidder, responsible is a key thing. And these reports tell me there's a real concern about responsibility with assessment of patients. My concern, all that aside, I watched what happened in Effingham and is going on in Effingham. I watched what happened in Mattoon when Mattoon Fire Department just got rid of their ambulance. It has taxed the rest of the, when I say taxed, it's put a huge burden on the other agencies because of limited availability within who does have the service. Right now you have a hospital that has transports that they're taking care of, I understand probably for the most part control. And you have 3, Eric, how many rigs do you run? 2, 3?
2 to 3 depending on the day.
Okay. If you go with the hospital on this operation, I will speculate based on what I've seen everywhere else, you're gonna see that ambulance service gone. And you're gonna see at least 2, possibly 3 ambulances removed from this county. That's going to put a burden on every other ambulance in this area. And I can tell you, even though we've got 6 or 7 paramedics in our volunteer department, we're volunteer. We're not here, we're not staffed 24/7. And you're gonna tax the daylights out of the rest of us trying to backfill this. And it's not, you don't have to do much homework to find where all these runs are and what it takes to backfill. It's gonna be a huge burden, and patients are gonna pay for it. On the patient care side of it, another point of interest, because this all comes from the top down, and I'm not saying the folks running an ambulance aren't good paramedics, I'm not trying to imply that, but patient care starts from the top down in the administration. Heart failure 30-day mortality rate is 10.2% at this hospital. Heart failure patients readmitted within 30 days, 21.9%. Just today, I was informed of a patient that walked in with symptoms of heart conditions. They were given a stress test and said, "You're fine, go home." A week to 10 days later, multiple bypass surgery. Patient care is serious. And I would urge, long and hard, you think about what you're going to do when you vote to take out $300,000+ of revenue into this county. And I understand the positives of not charging, the ambulance not charging that or not being given that, but you are going to take out a huge chunk of financial income from this county. And I don't know where you're gonna make that up at. Don't take ambulances out of this county, because when you do that, you're gonna tax everybody else. And I know Chrisman, you probably know better than anybody up there in Chrisman what they're going through trying to keep their ambulance up there. It's gonna have an impact on all of us, so I would think long and hard about the responsible bidder and what the history has been with patient care. That's all I have. Thank you.
Other comments?
You want that? You can have all that. Thank you, sir.
Sure.
I think I just need to respond a little bit to what was said prior to me. I think we're looking at 2 different things. They're having a problem with the hospital. I think we can put our record against anybody out there. When it comes to quality score, when it comes to different things, you know, we're graded just like anybody else. Just let you know that we recently received an award from the American Rural Health Association. As you know, I think we're a critical access hospital, which means we're small or rural. And so they do evaluations on different scores, but especially quality, financial stability, different things like that. And we happen to be 2 critical access hospitals in the state of Illinois that were awarded the top 100 critical access hospitals in the country. So, you know, things were said previously about how we had a disaster when we had the hospital or the ambulance service before. I wasn't totally involved with that. I know things changed. We went EMT service to a paramedic service at that time. I don't want to get into any of that other than to say things are much different now than they were then. We're under the same oversight as all the ambulance services that we, you know, our Region 6 we're involved with. We have to follow standards just like anyone else has to when it comes to quality or anything like that. So again, I think there's 2 things here. An ambulance service is an ambulance service. They go wherever the patient wants them to go. We don't dictate that whatsoever. The patient has total control where they go. If they don't want to come to Paris Hospital, they don't come to Paris Hospital. So we're looking at an ambulance service we're talking about now, and the quality and the service of that. That's it. I mean, you can say what you want about our facility. Again, we're talking 2 different things here, so I think we need to keep that in mind as we go forward. Okay?
Thank you.
Mhm.
Other comments, please? Yes, sir.
I got just one thing I don't quite understand is you're requiring 3 ambulances on this bid. that correct? Okay, so if you have 3 ambulances, but you run strictly transfers out of the hospital, and you have 1 ambulance on the transfer, now they've broken their contract with the county, because now they only have 2. If they run another transfer, now they're down to 1 ambulance, and they don't have any backup. You need paramedic backup. Kansas has a few, but like he said, part-time. Crispin's having trouble, so I don't know where they're planning on getting their backup from, because there isn't any other ones around here to fill in for what they need. So if you're running transfers out of the hospital with hospital ambulances, they can't be considered 911 ambulances.
That's right.
You're just defeating the purpose, because you're providing us with 3, you're using 2 on transfers, now you're down to 1. You're too short. It doesn't add up.
Just advise the board, this isn't a two-way. We can answer these questions once we've heard public comment and talk about it again. I'm sure that question will come up. Okay?
Thank you.
Thank you, sir. Other comments? Dale? Hearing none, I don't want to leave anybody out that's got anything to say. Hearing none, we'll go into committee reports. Derek, first item on the agenda is the ambulance contract.
So we had a bid opening on the 3rd, went through both of those, hospitals, low bidder, and it's $0 for the 5-year period. So appreciate everybody coming out today. This is an opportunity for the board members to ask whatever questions they have. I think all interested parties are here. Just to quickly just kind of talk about the concern about the 3 ambulances and how that works. The contract stipulates 2 ambulances 24/7. The 3rd ambulance exists as a backup and for other issues. So as long as those 2 ambulances are up and running in the capacity of a 911 responder service, that meets the intent of the contract. The 3rd ambulance can be used to fill other contract requirements. As far as transfers, that's separate from this contract. It is incumbent upon the winner of the bid to actually provide what is stipulated in the contract as far as coverage. Open it up for questions.
Questions, board members?
If Verizon gets the bid and we will not be levying any taxes for 5 years, within that 5-year period, say someone else comes in or we rebid it, can we go back and levy the taxes again at the end of the 5-year period?
Yes.
Is it gonna be voted on by the people of the townships? Or
It still
by
exists, the levy
Still-
still exists, it's just levying $0.
We can take any levy that we now are currently activated or authorized to make and not levy it, but we always have the option to levy. Okay?
And I wanted to make a comment on the tax levy. To wrap my head around the numbers, I went in and talked to Don Wiseman, and we pulled up what we considered an average property for Paris. $1,200 a year property tax on it on a house in town. $25 of that goes to the ambulance service.
Okay.
So, back of the envelope math, for every $1,000 of property taxes you're paying, it's probably about $20 goes to having ambulance service.
However, farm ground is a different story.
Farm ground is a different story, and as a farmer, I'm gonna speak up on that one. We grumble about the price, but agriculture's generally the 2nd most dangerous occupation in the country. And we're the ones that's hard to get to. The ambulance goes to the back of my hayfield because I, ran a hand through a baler. That's doing a whole lot more wear and tear on the ambulance than it is just pulling up to a house on an asphalt road. So, there is an argument that the farm ground's carrying more of a burden of it, but I think they're kind of getting more benefit from it too, just
Do you
by
have,
location.
do you have a figure on that?
I don't,
Okay.
yeah.
Jeff, do you know, just out of curiosity?
No, it seemed to me there was about $1.38 an acre, but
Eric, I'll look it up for you.
Okay.
I looked it up one time, I had Carl's. I picked
Right.
up some of Carl's farm ground.
I
and it
may
wasn't-
not remember correctly.
Right, I'll look it back up.
The acreage, the farm ground is taxed differently than what.
Right, you
the-
can't use
yeah,
the same
Yeah, it's completely different than what it is for livable
different
property.
criteria. Yes,
How much tax money do you pay a year? Can I ask that question? Hospital won't be paying any, but how much do you pay a year for your property and all that
7,000.
total?
For the ambulance service?
Yes.
I have to look it up. I don't remember, because we have the 2 buildings and the lot,
Right.
and they're on different tax bills.
Right around $8,000, I think, if I remember off the top of my head what I paid.
Property taxes,
For the buildings,
for the
because they're
ambulance
commercial buildings.
70,000?
No, 7 or 8.
Oh,
service.
we gotta get some of that.
Good and strong.
Of course, they're down there in that area where, you know, we've had other issues, so.
Are you guys, this is a question, so financially sound that you can, do your business for nothing? I don't understand that. It doesn't seem reasonable to me. Who in their right mind turns down tax money? Just a question. I'm just a,
But we went into this whole experience like over a year ago with the idea that we consider ourselves, and we should, the healthcare provider in this community, in our surrounding communities, okay? That's on us as being the hospital in this area. Now, along with that, we're looking at other ways to benefit the community. And there are things that because we are a non-for-profit and the tax things that we get, we see ourselves, we have an advantage on some of those things, we just do. And so we feel like that any way we can to give back to the community, because this is not something for us, again, we run a hospital, that's our main focus, okay? But we view the ambulance service as a very big supporting piece of ours, because we can do a lot of things with that other than just bring patients in and out of the facility. We can use this, we're doing a lot of things when it comes to population health in the community and what we can do, how we can help older population that can't get in and out to us easily. We can do a lot of things to augment what we're doing, because we're gonna be measured on quality of care going forward with Medicare and all the different entities that are involved in our profit and loss for the year. It's just not a matter of numbers anymore, it's quality scores, and we get graded on those, and we get actually payment, especially for Medicare on those. So our point is, if we have good quality, we're gonna get more reimbursement, and not only that, this is gonna work to our advantage when it comes to providing the care for the community when it comes to ambulances. We've got a lot of different things, and what we can do, if we can save taxpayers money, and we think very confidently that we can, then we wanna do it. And we're very open to making sure that anybody that has anything when it comes to the operation of the ambulance service, it's there, black and white.
okay, let's just say offhand, this is all just a supposition, okay?
Mhm.
That we get the contract for those guys. Are you gonna stay in business?
Of course.
Well, then, why would that be a smart move by us if we're concerned about covering the entire community? Why would we just give them the contract? You know, we got all of it. I mean, listen, the people of Edgar County are better served that way. I don't know whether this is fair, it's just my kind of thinking, I guess. My concern is the people. I know the reputation of these guys, I'm not really familiar with this. I mean, I know that all people I like, I have no personal interest in it unless you're coming to get me, then I have a real interest in it.
I guess the main argument I have, you've got constituents out there that I think, you know, it's always tough to make the dollars go where they need to. And I think you've got an option here that's gonna give you some.
Sure, I just think that if
that
that you guys get the contract and you find yourself financially strapped to in the end, the person that you're taking on the stretcher is gonna pay the bill. You're gonna raise it. Just, like I said, I got no personal feeling about this. I want answers to my questions. This is an important deal.
Understood. And we're gonna have to be charging the same as anyone else. You get so many dollars per run, you get so many dollars for Medicare, you get very little for Medicaid, obviously, you get commercial pays. But, I mean, it's not, we didn't go into this lightly. We know what the numbers look like, and we feel very confident that we're not gonna run into that problem, or we wouldn't have bid what we bid.
Okay.
I get there's a big differentiation, and you guys
Big?
have
That's
lived it.
understatement. That puts us in a really questionable spot here, because I think, as long as I've only been on this board for 2 years, but I've been around these guys enough to know that they wanna do the right thing, and what's right for the county. And when you got one group bidding nothing, and another group probably bidding what they ought to bid, or whatever, that puts us in a bind here. Because if we say, well, we're gonna go with them because we save tax money, then these people have done a tremendous job, they're out in the cold, I mean, we're getting hit from both ends here.
I think the main thing from my perspective is this bid, you have total control over the quality of this service. If you have a problem with that, you can immediately make a change. Okay?
Well, that's,
It's Dan's.
Dan's first.
On page 4 of your bid, about halfway down, it says, service to patients, the ambulance district, regardless of ability to pay. And the next paragraph says you set up a financial assistance program. What I'm gonna ask, if, for instance, I was transferred to the hospital last year, my bill was $1,700. I end up paying $250 of $1,700 because I have decent insurance and Medicare. What happens if you transfer somebody or fix up somebody, they have none of that? Are you gonna help them set up a way for them to pay, or are you just gonna write it off? What happens if they can't pay? What do you do then?
This is what we have our charity care program for, Dan, and I think you know a little bit about that.
Yes, I do. Right.
People can sign up, and if they fall under a certain level, that's what we do. We try to get them into a Medicaid coverage if they aren't, if they've not tried. Some people don't. So we try to guide them there to wherever they can get coverage, and if they don't have it and are incapable of paying, yeah, we'll write it off.
Okay.
John?
Well, I was just going to bring up, you had mentioned, control and talking, and that, to me, that is one issue against you guys, because with zero tax dollars, we don't have any control. Whereas, I know Derek's talked a lot about wanting to institute call times and things like that.
Mostly Carl, but yes, I mean.
Okay, or
that's
both,
important.
and,
A big priority for me.
in all fairness, if we don't have money in the game, we don't have control. We would have no leverage against you. So, I mean,
Well, I think the way the
just pointing that
contract's set
out.
up, I'm right, Ron, once you agree to the contract, there's no, it's stipulated what the amount of money is. I think that you're kind of bound by that contract to stay with that, unless you just get rid of the service.
And I would say, we would hold it in breach and rebid if that was an issue, right? So,
Yeah, but then we're looking at getting another ambulance, or, that's,
absolutely, but
Yeah.
that's secondary or separate from your
No
point,
tax.
right? So,
Yeah.
the reason why we go through all this and set those contracts is to have the control. And so, whether the bid's 2 million or 0, that still holds true, right? So, just to circle back around, can you speak specifically to a individual or corporate insured Blue Cross Blue Shield individual? You were talking about, there's differences in price, or there's controls on pricing. Is that absolute throughout to include those that are able to pay? Do you have any latitude as far as what you charge on a run?
You can bill anything that you want, but it doesn't matter what you bill, you're only getting paid based on your contractual obligations. So if you have a contract with, let's say, Blue Cross Blue Shield or Health Alliance, you've negotiated that rate and that's all you get, no matter what. Most insurers follow Medicare guidelines or CMS guidelines and only pay what Medicare would pay anyway. Medicaid obviously pays way less than what Medicare would pay, so it doesn't matter what service is billing technically what amount, they're all only getting paid the same. That's a federal mandate. I mean, that's CMS guidelines.
Can I expand on that? Because that's not actually true. You have to do a yearly evaluation of what it costs for each level of service. And what that is, you have to take in the totality of everything. This is what CMS dictates. CMS dictates that for an ALS-1 ambulance call, which is the HCPCS code 0A428, is the HCPCS code for that.
On that.
Well, I want to be accurate. So, it says for every level of service for that, you have to know what it costs for you to provide that service. So every year, we have to do a cost analysis of our service to provide that service. So we have to take into consideration the wages of the employees, the fuel of the vehicle, the insurance of the vehicle, the workers' comp, our station supplies, the supplies on the ambulance, and what it takes to provide that level of care for each of the HCPCS codes that Medicare dictates. So there's BLS emergent, BLS non-emergent, ALS emergent, ALS-1 emergent, ALS-1 non-emergent, ALS-2 and specialty care transport. Those are the HCPCS codes that Medicare says you can bill on. So for each level of that service, we have to go in and figure out what it costs us to provide that service, and that's what our billing's based on. So there's an ebb and flow with the ambulance billing. So one ambulance could bill because they have a lower wage or lower supplies, that their bill could be $200 or $300 less than what our bill could be, because we have to factor in the totality of what it provides to have that ambulance available to respond to that. So
There's a specific formula that Medicare puts out to determine this as well.
And is that specific to region, is that county, and how does
No,
that work?
no, that's a federal one that goes right nationwide.
And so that, whatever the aggregate tells them, they.
Right, so if Transcare
drive
and Terre
costs.
Haute does an ALS-1 run, they have to know what that bill is. They figure that out, and that's what they can charge that patient for that year. And every year, we have to do this. The cost of medications on the ambulance go up, they go down. So there's an ebb and flow, kind of like agriculture. And so some years our bills may seem a little bit higher. The next year, because we get a better break on the supplies and everything, and the fuel costs go down, we can charge less. But it's not just whatever we want to charge. There's a flow that you have to figure out for those.
But that's for you individually, it's not the aggregate, I mean,
No,
everybody has to do it, but they don't average everybody's price.
If
Right.
you're ever questioned or audited and Medicare wants to know how you came up with that, you have to be able to show your statistical value with their formula and how you come up with that. And then we take ours and we compare it to, I do 5 or 6 reviews with other ambulance services serving the same demographics. They're not just in Illinois, some of them are Indiana, but same demographics, same service area,
Same payer makeup.
same payer mix, same populations, rural, to compare what we're coming up with to what they are. And if we notice, and we do this every year, and so we notice if there's a huge difference, then we can reach out and see what they're doing different as well. You know, if they have a different supplier that they're getting medications from, if their payer mix has changed, what has come to the market has changed that.
And to get back to the tax bill, I couldn't find a good one on Carl, so I pulled up Dale English's. Thanks, Dale. Dale has farm ground that's got 37.57 acres, and in the special service area, he pays $30.90 for those 37.57 acres. So less than $1 an acre.
So I'm gonna back
And
up
I'm paying what
and
in the, yeah.
come
One at a
back.
time, folks.
Eric's, we have to do the same thing. That is a private ambulance service, so theirs is different than a hospital-based ambulance service. We do the same thing. Ours is called a Medicare cost report, and we don't do ours annually. Ours has to be done quarterly. And then we have auditors quarterly that come in, and our C-suite guys are completely recused. Auditors have to go through all of our books and make sure that everything matches exact same way, except ours is done quarterly, and ours is called a Medicare cost report. Our ambulance service is a department in that cost report, if that makes sense. The same way emergency room is, the same way surgery is, the same way the clinic is, that type of thing.
Yeah.
Yeah, I noticed, on your bid year by year, you keep increasing the tax money. Last year, I think we levied at the maximum,
No, we
No.
levied 345.
I knew the.
We haven't been
something,
levying at
that
the
wasn't the
max.
maximum.
Say, the max is 20 and we did 18,
Okay,
right?
Right,
so the 5th year that you're asking for tax money, is that still within our range of
that is,
levying
that
that
would,
particular tax?
actually, we have been received, over the last 5 years, we've received less than the maximum levy.
Okay.
Prior to
I
that, we
just
didn't
wondered.
receive the maximum levy. So we took what the assessed value is for this year, and put it at 19 cents per $100 assessed, and then we went up 1/4% each year to, at the end of the year, we would be back at the max levy, but it was based upon the evaluation of the property today.
Yeah, I thought we was at
Not-
the maximum last year, we weren't, okay.
No, we
We've been
haven't been,
moving it up
Okay,
based upon their asking.
okay.
And, you know, we put in there part of the reasons why, but, and one of the other things that we took into account with that increase is the minimum wage increase that is being initiated starting this year for the next 5 years. So when we figured up what our payroll is and we do our long-term budget, you know, we wanna know how that's going to affect us over the next 5 or 10 years. So in 5 years, when we hit that $15 an hour, right now, at minimum wage, if they start for us, they would come in at $30,668.88. In 5 years, it's $49,740. It's almost a $20,000 pay increase per employee for those. So, unfortunately, you know, we have to take that into account as well when we look at our budgetary items coming up for our long-term budget.
Yes, John?
Can I assume that payroll and associated costs is probably by and large your largest single expense?
Absolutely.
payroll and workers' comp
Right.
are the biggest, because workers' comp here is 3 times as much as it is in Indiana. So we pay almost around $70,000 a year just for workers' comp, and that's payroll driven. Because by whatever your payroll is, you pay a percentage of that to workers'
Right.
comp.
So when the payroll increase goes up every year, unfortunately, our work comp value.
And social security and.
Right, and someone asked what our taxes that we paid last year, we paid $7,498.06 on the corporate buildings.
Carl, do you have any questions at this point?
I know Ollie said something about patients have the right to choose wherever they are saying. Is there any regulations from the state that controls that at all?
No, there's a federal government that says that
I think he asked Ollie a question,
Yeah.
okay?
So, or either one of you, you know,
Okay, I'm sorry,
is
I
there,
didn't interrupt you.
you know, that was a concern I had, that, you know, patients do have a choice. And that should be a priority. I mean, you know, maybe there might be circumstances that, you know, I don't know, I'm just curious whether it is.
CMS, Medicare says what's considered a locality, what the local hospitals are for the locality by zip code. And basically, the locality for the Paris zip code, these are hospitals that if you are a CMS patient, you can get a service and go to that hospital and get treated for that, at that hospital, and you don't have to pay as if you're going somewhere else. So it's, right now, the local Terre Haute hospitals are in that, Union Hospital, Clinton, Sarah Bush, Carl, Carl's not in the locality for Paris, but for like the northern part of the county, it is.
Yep, like Brockton, nothing based
Well,
on.
but say, you know, you go to a car wreck and you got a very traumatic injury, well, you wanna take someone to a trauma center.
Right, our protocols aren't, Region 6 says that you have to take certain patients to certain localities.
And that's, everybody has, all ambulances have to follow that guideline. Right, okay.
Now, if you go on somebody that has abdominal pain or arm pain, and they say that they want to go to Carl, because that's where they were last time, Medicare will not pay for a transport to Carl or something like that when we have 5 additional hospitals that are closer. The patient's required to sign an ABN form, and then they're responsible for the excess mileage to that facility, and have to let them know ahead of time that can happen. And that they will be billed for that, because Medicare says they have to be. They will not allow us to take patients 63 miles away when we have 5 other facilities that are in their locality deemed by CMS.
Okay,
So it's kind of a two-way street.
Anything else, Carl?
well, I've got quite a few things.
No, that's fine. I just wanna make sure.
And maybe some of them I don't feel like, based on what I'm gonna get today, that I'm gonna be able to make a decision by Wednesday. me personally think we need to table it. I've got some further things that I wanna go meet with the hospital people. I wanna look at their facility. I've got some more questions that I don't wanna take up a lot of people's time, but, you know, there's radio issues that I think you guys are aware of, and I know I've heard this from dispatchers, 911 coordinator, firemen, about some radio issues. Protocol issues, I mean, you know, if you guys get the bid, I think definitely with the 911 coordinator, we're gonna have to have some training sessions to address some of these issues, you know, prior to the contract. You know, that's stuff that can be worked out, but, you know, there are some issues that we have to work on. The transfers, that's a big thing for me. I know with the contract, you know, we have the 3 ambulances, you know, and in your bid, you put down that you would have 2 crews, 24/7. And with the 3 ambulances, I guess my concern is that you're gonna take care of the 911 calls. The transfers, that's your business, how you're gonna handle that. But I don't, with these 3 ambulances and the crews, I want them available at all times to handle these calls. So I don't know how you're gonna handle the transfers. I know I was told a month or so ago, there on a Sunday, there was 5 ambulances out in the county. You had 2 of your ambulances out on transfers, and Chrisman needed an ambulance, and Eric's ambulance had to go up there. So, you know, is that gonna be a problem if you get the contract? You know, if you got ambulances out on transfers, you're not available to handle 911 calls.
Correct.
That's my total big issue here.
I had it boiled down to asking it this way, and I have this very same question. I guess my question is, you've got 3 ambulances, are you going to handle transfers with other vehicles?
I think what you have to understand is, we bid this based upon a 911 service. Transfers, to your point, are a completely different business model and different operation.
Right.
I have not adjusted my current business operating model because I currently don't run 911. So, if Horizon Health was awarded this contract, I would have to take my current model and run 911 with that because my current model meets your 911 contract. My transfer model may have to go on hold for a while until I can increase my staffing, increase my amount of rigs, increase that to get to that point. I would have to utilize outside services, something of that nature in order to handle that at that point. But as of right now, I don't have a 911 contract, so it would not make fiscal sense for me to increase staffing, increase rigs, because I can currently handle my own transfer volume.
So the simple answer to that question is, if you are awarded the contract, you would first honor the contract and then adjust whatever you had to do as far as increasing your mobile units to handle transfers.
Correct.
Is that correct?
That is correct.
Can I ask a question on that? If you do that, who's going to do your transfers? Because TransCare is not Illinois licensed. CARES, AMR's not, and they're not even in Terre Haute. Kansas is a volunteer service that sometimes has paramedics. Chrisman has their own issues and are running an ILS at times, and that's who your backups are gonna be. So who would you use to do those transfers? Because there aren't any ALS services available.
I'm assuming you'll still be in business, that you're not gonna shut your doors on day one. If you're not,
If we don't have a way to generate revenue to pay our employees, then we won't be there.
So you will have.
I mean, that's
Yeah, and that's
but
another,
you have another service 15
You're right.
miles across town.
You're right, I do have another service
that is
that is
Illinois licensed.
Our service over there is not part of our Edgar County stuff. We keep them totally separate. They're 2 separate companies.
you know, that's a concern I have, you know, because I'm assuming if you get that Eric's service isn't gonna be available. And
That's,
then,
can I stop one second? I just wanted, it was asked of you folks, if you are not awarded the contract, what are your plans?
The company will have to shut down, because there's no way to generate revenue to,
Sorry.
because we don't do the transfers now.
right,
The hospital calls us very rarely for a transfer, so we can't staff and pay people employee salaries, not having any way to make runs.
right.
Okay, I
Yeah.
just, you hadn't been asked, they
So-
have been, and I wanted to make sure.
So, I guess, the backups, that's another concern I have, you know, Kirk briefly addressed it, you know, we got the Kansas ambulance, which is volunteer, and I know in talking to 911 people, sometimes when they page them out, they're sitting for 10, 15 minutes waiting to see, are they even gonna respond? And because, you know, in the daytime maybe, because, you know, people work out of town, you know, they don't have as many people available. And I noticed with your mutual aid agreements, you have one with Kansas, you have one with the Oakland ambulance, which is volunteer, you have one with Clark County, not the Marshall ambulance, you have Clark County, and that's out of West Union, Martinsville, Casey. So our backups are
Further and further away.
further and further away, and
Well, I
I know.
guess to my other point though, if they are going to close their doors and I have to increase my staffing model, there's a lot of unemployed people that are currently looking for jobs to be able to do a
Right.
transfer service.
but, you know, I guess my concern is that if you're only planning on having 3 and 2 crews for 911, then our backups are limited, and, you know, to me, that's the key, to have quick response. And not only quick response, but good, reliable response. And I've read through your bid, you know, you've got a lot of qualified people. You know, you got a lot of several out-of-county people from Mattoon, Charleston. And obviously, if they work as EMTs over there, they've had a lot of experience because they have a lot of runs over there. But another concern I have is, I don't know what percentage of them are out of county, but they're not familiar. I guess they can become familiar with the county, but, you know, that's a concern. You know, there's some other issues, minor issues that I don't want to bring up now.
Let him finish.
You know, if we leave it the way it is, can both services stay in business without putting out a bid for one service? Is that a possibility?
I think I asked that question.
What do you mean without county funding?
No, I mean, you get county funding, they do what they're doing, can both services stay in business over a period of time?
That's the question I asked earlier, they said yes. Well, they said that, I asked them if they get the contract, what are they gonna do, and they said status quo. Is that right or not right?
That's right.
That's what
We're
I
not,
heard you say.
we're not looking to, we're gonna have a service. Because I
Yeah,
think
that's
it's
just,
important to have a
everybody's
service.
question,
That's what I
they
asked
answered.
So right now, it seems to be working halfway decent.
Oh,
It's working great.
anything else right now?
Not
I
right
know
now.
you have a lot of, I have a question on your bid. Guys, you list the first year, and I'm gonna just say 381,000. We've already done the levy, and that's gonna fall short. So are you willing to sign a contract for the amount of levy for 19?
Yes.
Okay. I just wanna, I figured you would, but I
Those
wanted.
numbers are without the abatements, right? With the abatements and everything.
I think we have too many
Yeah.
questions to make a
It'll turn out to be about,
Yeah.
I'm sorry.
Sorry,
Okay, we went, all right.
Chairman?
Yes.
Did you talk to the state's attorney? You know, we talked Friday about the money that's levied, and then if it's awarded to Horizon, what we do with that money.
I've asked, I have not received an answer. It's, we have other monies that we have put back for that from the last time, from 10 years ago, amounting to well over 100,000. What we're looking at is that first year levy that wouldn't go to anybody, given that Horizon was off, or allowed to have the contract. We'd have roughly $340,000 coming in, and we would just simply hold that back in the event that we don't want to have happen, that there might be some issue. And we wanted to make sure that we were legally able to do that.
But then also at the end of this 5-year contract, we're not gonna know when we levy in December what's gonna happen with the contract, so that money, if it's sitting in the fund, it could be used.
Right. Yes, Kurt?
Just as a point of reference, just food for thought, with whatever decision you make, and I mentioned Effingham earlier, and I mentioned Mattoon, and I don't recall, maybe you guys know, or maybe you know, there was an agency in Mattoon that has now disbanded. Mitchell Jordan is ordering new rigs, because Mattoon got out of the business. Now Mitchell Jordan is ordering new rigs. There's a serious time lag. If you talk to the folks in Charleston, and all of the other outlying back to this further and further away, the resources just aren't there. There's a huge patient care lapse that's happening.
All over the state. It's not just here.
And it happened because of a decision that was made without a whole lot of forethought. I appreciate y'all having this conversation and making this long-term plan. Effingham, they're gonna cover the whole county with 2 ambulances. That lasted about 3 weeks. And they are in a nightmare, and they're in court, but all that aside, I emphasize, don't take ambulances out of this county. When you do this, if you remove that entity from operations, you are going to have a fallout that, I'm just telling you, it's gonna happen just like it's happened everywhere else. Food for thought. I just know, like you said, man, we're struggling to keep people on the rig and keep them available, and it's not getting easier, it's getting harder. And I don't know how we're gonna do it. We got mutual aid agreements with everybody, but if we don't have the people to send them, we can't send them. I mean, that's just all there is to it.
And on that same note, somebody made a comment that if we close our doors, we'd have people, you know, a lot of unemployed people. It's not the fact. They will go with us to Indiana. We've already talked to all of our employees. We'll have to do restructuring over there, but they will go. So, and you asked Stacy as an employee, the employees have no intent on staying in the county and working. And most of them move out of the county to Indiana.
Is there a way we can table this for a while?
Also, I want to ask the question as far as your ability, if it is tabled and pushed back for another few weeks, because I assume you guys, if you wanted the contract to be ready to roll, because you're currently in position, you are the ones that have the financial concern. So with a lag in time between, you know, what was expected to be a fairly quick decision once the bids were in, what kind of position does that put you in if we delay this through? So what I assume we're talking about is a special meeting in order to vote on this.
Absolutely.
Yeah, I'm not thinking we're gonna wait till May.
Maybe
So
thinking 2 weeks.
a week or two,
Yeah.
is that
Max of 2
sufficient? You guys can handle that? Okay.
And the answer to your question is, Dan, when it comes up on Wednesday, there's a item on the budget, or on the agenda that simply says the awarding of the ambulance bid.
Absolutely.
At that time, then a motion could be made to table for a specific period of time, I would hope. And that would be our, we can't table it this morning.
Well, I understand that.
I know, I just-
Yeah, right.
Obviously, you know, we all have a lot to think about. I'm glad everybody's here, because I think this has been a really good discussion. It's not an easy deal. Yes, Andy?
Do we have
I thought you
anything?
were,
Well, I just-
we still like it, we haven't heard from you.
We wanna hear from you. Do you have any questions?
I just want to verify that the contract stipulates 2 ambulances, correct? And one, but no,
No, 3.
you stipulate two
Two
fully staffed.
ambulances, 24/7.
And what's the
Okay.
purpose of the third one?
Is a backup.
It's about backup, not necessarily to be staffed, but
That is
They-
not currently stipulated in the contract.
Okay.
So that would be, you know, and a lot of that, so because the way that request for bid was structured, any deviation from those bigger pieces would have to be a discussion and agreement between both parties.
What are you saying, the
Right.
third one could not be used for transfer? It should be
There's
sending or
there's
waiting?
no stipulation in that whatsoever.
so you're just like, let's say they wreck the thing, you got an extra one, immediately you
Right,
can
breaks
step right
down,
in.
whatever it is, that was the discussion as we were building this, what we wanted as a minimum to have in the requirement.
Originally, said 4, and then we changed it to 3, because basically we said we didn't really need the 4th ambulance, is that correct? So
Right, it
we
was
dropped
part of
it
the
back to
discussion.
3.
And so, from the beginning of this, as at least, and I think I speak for everybody, but my mandate was maintain same level of service as much as possible, and also cast as wide a net as we can. So make it reasonable where we are not, because of draconian restrictions on what the contract would be, we would have people say, you know what, not interested. I would, so that was those are my two first principles, putting this together.
And looking at Horizon, talking about the ambulances, Horizon Health, they said they would currently own 2 ambulances. They're gonna add a 3rd one, as well as a paramedic assist vehicle. And I think you have that also currently
Yes.
with that. I mean, plus 5 ambulances and the
We have
paramedic.
5 ambulances and 2 paramedic assist vehicles.
Okay.
So you have 7.
We have 5 ambulances. The paramedic assist can't transport, so we have 5 that can transport.
Yes, we have 7 vehicles right now that can respond.
That's what I mean, okay.
Now, you can't transport, what did you say, a paramedic cannot
They're
transport?
designated by the state as non-transport. Cannot use them to transport.
Trunks aren't big enough.
Pretty much.
I would like to remind you that once we, whatever we do with the contract, whoever we award it to, then we have to come up with a contract that is based upon that bid and the documents they've submitted and any other agreements that we both want within the purview of that bid. So we still have some work to do after the acceptance of whoever is going to be awarded the
And
contract.
it's important just to point out, and just to reiterate or reinforce, that we can't have requirements that are beyond the scope of that bid spec out unless we have an agreement with the other party.
Right, in other words, Eric or the Horizon may say, we're gonna do this, we'd like it in the, yeah, we
can't say
can't,
you're gonna have
we
an
can't
airplane
unilaterally
or
at this
whatever.
point start adding to
Right.
things.
Right.
Or taking things out.
Or take things out, unless we agree to it too, so.
This gentleman has a question.
Oh, yes, sir.
We're hearing a lot of ifs and maybes and ought to be's and should be's. I think what you guys really need to sit down and consider is patient care. You're looking at all the people in this county that if one person calls for an ambulance and has to wait or doesn't get it, that's a problem. And I don't care who it is, it's a problem. Or vice versa, if their ambulances are out, whoever's are out, and you have somebody sitting at the hospital needing to go to Carl, and they have to wait, that's patient care. You can't deprive the people of this county that on maybes and ifs and whats and well, it should have been and it could have been. Patient care is the main thing that we're here trying to get taken care of. And that's what we gotta look at, people. That's the main thing.
Carl's been really thorough about that, I think, about patient care. I think that's his #1 priority.
It should be.
Okay,
And we're very fortunate in this county with the volunteer, paid firemen and volunteer firemen. Majority of them are trained, and I know for the Paris, this area, when they go outside the city limits, all volunteers are paged. If they go to Vermillion Fire Department, in most cases, they're there before the ambulance. And, you've got the same thing in Oliver and Grandview and Redmond. Same way in Kansas, do you have Ashmore come? Fire department, and Hume, all the fire departments are good about helping, and that's a big plus. That's just more hands.
there are a lot of heroes out there, first responders. Okay, are we wrapped up for this morning? Anybody have anything else?
Do you have any committee reports?
Well,
No,
Well, we have Lori sitting there,
as
can you
far,
top this?
no,
Oh,
as far as this subject, okay?
and I wanna,
You're not off.
sometime this
yet.
week, set up some time where I come out and ask a few more little minor questions and look at the facility. I would appreciate it if we could set that up.
Okay, thank you all. You're welcome to stay. We've got some other stuff to talk about, but We appreciate everybody's input and their thought and caring about the county and its healthcare. So, thank you all. Andy, do you have Ori?
Let's let him explain where we are on things.
Yeah, you're gonna get a complex, somebody's walking out when they say Warrior's talking next.
Seriously, why did you drive all those people out? What have you done?
I'm gonna be brief.
Famous last words.
Well, we've spent probably 2 hours a week and a half ago with the Building and Grounds Committee going over this stuff, so I don't want to get too far into details with that. But really where we're at is we finished the investment grade audit of the facilities, and then we sat down with the Building and Grounds Committee and did our toggling and went through all the measures and kind of talked about them in a lot of detail. So what I brought today was basically a one-page summary of what we went over in that meeting, which is actually 2 pages because we broke the health department out as requested by the building grounds guys. So you can just pass this around.
So you did check out the health department?
Yeah.
We had a meeting there. They were wondering what the things were on the door.
Yeah, the logging sensors that we put out. So yeah, so really, the thing with the health department actually is that out of all the county buildings, that is the most inefficient building by far.
Actually, it was a lot 2 years ago before we put in a new
Yeah.
heating and cooling system too. So.
And the thing with that system is it kind of got you part of the way there, and then what we're looking at is getting you all the way there. So we're actually working with Sycamore Engineering because
Probably.
they were the ones.
With the heating, I think some stuff was placed in it.
Chris, you weren't just remember when that north wall was all glass,
Right.
when they first built it.
Right.
There's a lot of things that.
So we're looking to do some stuff with that wall to make it a little more
efficient.
efficient, and then as well as getting those that long heating fan coil system that they have in there right now.
Yeah.
So essentially, we made some revisions after our meeting, went back to subcontractors, updated some pricing, and really what it's looking like is it's both, all of the facilities and the health department are kind of at the same 15-year target right now, so that makes it a lot cleaner. And really where we're at is, this is a project that's paying for itself, and we show the savings there. It's close to about 40,000, just shy of 40,000 total between all the buildings and the health department and utility savings per year. So pretty good reduction. I think that is almost up over a third of the current utility spend is getting lopped off. And then as well as those maintenance and equipment replacement savings that we show there. So that's really where the snapshot of the project is. At this point in the process, what we do, and it's kind of funky, but what we do is we have a resolution that essentially allows us to continue to finalize the investment grade audit report and look at the funding options. So this resolution doesn't tie you guys into doing the specific project. It just gives us the ability to finish our stuff. And we just want to minimize the amount of revisions we do to that because it usually takes a couple weeks every time you revise it. So we just like to try to get it as close to the scope that you guys want to do as possible. And then we'll go through those final, and so there's always going to be some things that we have to discuss as far as pulling things out or adding things in, and just, but this kind of allows us to get to that point. So I will go and take this information to my people and come back with basically everything finalized, firm, fixed, and at that point you guys will make the final decision on what you want to do with the project.
What's gonna happen to the health department?
So the health department, the way we have it set up, it'll be under the same contract, but you'll basically be responsible for their savings that's a part of the project. So they will still be budget neutral for their facility.
Okay,
And
that's
that savings,
They're not paying money?
they'll have to pay the county, similar to
Well,
like,
I mean,
it's really however you guys want to set that up.
that's up to them. If they wanna go along with it, then that's what they'll,
I thought we talked about keeping them totally separate.
well, I don't think, I guess I see it as separate.
See, they pay their own utility
Right.
bills,
Right.
and we can't
But if their utility bills are 40,000, or let's say 4,000 a month,
a month.
well, now it's 2,500,
Yeah.
then they're saving 1,500, which they put toward ours.
Would we,
We would, in other words, the difference between their utility.
in other words, wait a minute, wait a minute.
Sort of.
If their line item is $50,000 to pay utilities, with the savings, it's now 30,000. That's what they expect to budget. They want the savings.
Yes.
Who's gonna pay for their fixes?
Right. They're gonna have to, they're gonna have to,
Is there a way that we can basically have them pay us the difference through the term of the
That's what I
contract?
was thinking.
I don't
Some
know.
sort of,
I don't
Is
know,
that what-
because we get
Is
into
that the way they
trouble.
normally work though?
That's typically how, if there's a building commission or a health department, sometimes the highway departments, they're on their separate budget, completely separate. They essentially just have an
Okay.
internal agreement, similar to like your health benefits.
Okay, I'm with you now. It just took me a second.
Is there a
I'm
reason
sorry.
why they're considered a separate entity in the county?
well, just the way that they're.
The way it's set up, the funding and stuff?
Right. No,
If they're
I
on
understand
board.
that. I'm sorry, something clicked.
Okay.
That should work, and then they would pay us, and ultimately, they would get a benefit, ultimately.
I mean, it's gonna be budget neutral for the 15-year period to them,
Correct.
and then,
And it's getting
then
them
after that,
stuff
they're
that's
on their own, you know,
really,
they're-
a lot of issues there,
yeah.
and a lot of complaints,
So-
and I think it's gonna fix a lot of that.
Yeah, so if they're paying 4 and it drops to 2,500, then they would pay us $1,500 towards the equipment and so forth, and amortizing the cost of everything that we did for them to save money. Is that correct?
That-
That's the
Bingo.
way I see it.
It took me a second, okay.
Yeah, so it's either they pay the financier or they pay you guys, and it's cleaner if they pay you
I'm with
because
you.
it'll actually, because of the larger
The larger
project, you'll get a
amount,
better
right,
rate,
you'll get a better
and
rate.
it'll just be, it'll be a lot
Perfect.
easier.
For some reason, I couldn't make that work, and now I understand.
See now.
Sorry. Hey, you're out of order.
And
Maybe right,
and we'll
but you're
have that
out of order.
amort schedule all set up and what each entity
Sorry.
is responsible for, so that'll be provided in advance, so they can budget forward
would
15 years, because they'll know exactly what the amount is.
And I wanted to bring Jeff up, because we talked about this in the committee meeting, and we all know there's a way to do it, but that's where we needed to bring you into the conversation, because
And Derek-
we need to know the exact nuts and bolts vehicle way to work that. You know, we're all in agreement that it should work, but,
It should.
yeah,
It
but,
should. It
but
just
somebody,
clicked.
but you're
For
the one
some
that knows
reason,
all that
that-
stuff, so.
Derek explained that to me,
My fault.
sort of, yeah.
Okay,
No,
glad to know you admit
You
it.
didn't understand
Nice
it.
going, Derek.
Yeah, good job.
see, I thought we were gonna pay the whole bill and, never mind. It's-
However
now-
it works, we don't really care as long as it balances
The
out.
financing is a little, and it kind of explain that. The financing is not like you go to a bank
Correct.
and get an interest, I mean, explain that a little bit if you could
Okay,
to
yes.
everybody.
So essentially, the allowable mechanisms for funding these projects as part of the legislation is a bond or these lease agreements. So it's essentially it's a lease purchase agreement of the equipment, and the reason why it gets structured that way, there's specific language within that agreement that makes it different than a loan and different than a bond, whereas it's subject to non-appropriation every year. So essentially, it's an annual commitment, but the 15 annual commitments. So it's not considered a long-term obligation by the county, because you have the option to non-appropriate or terminate it at the end of each year. Obviously, you're not going to do that, but that's there as more of a protection for you, because there are some, I don't see that as an issue in this county, but there's other counties that have situations where they could potentially lose a facility. And Pulaski County is an example, whereas 90% of their project is from their jail facility, because it's an ICE field office for Chicago. So if they lose that ICE contract, 240 of their inmates are ICE inmates out of 242. So obviously they don't need that facility anymore. So that's a scenario where obviously there's some risk there for them, but because of this mechanism, it allows them to not appropriate, and then the financier is not allowed to take legal action to collect like they would with a bond, where they could go and take taxpayer dollars and things like that. So it's just kind of it's a different type of mechanism.
Have you
got a
discussed
question
this
based-
with- Have you discussed this with Janet at the health department?
Janet's been involved, as far as the actual board themselves And that's something that I can talk to them about it and review this with them, and just let them know
What is the 15-year, how much is the payment per year?
So that's what this next process will be. Essentially, it's gonna be based off of these savings numbers that are here. It'll be structured to be less than those savings numbers, so that money will be there, available for you to do that. And I will, as part of this process, I'll come back probably within the next month with an amort schedule that's gonna tell you exactly what that savings, what that number is.
The issue we've got now is that the state's attorney was not able to review, so it's not on the agenda. I don't know whether you've told him that. We needed to put it on the agenda by 9 o'clock this morning.
Okay, no, that's fine.
But the state's attorney has not signed off on any of this stuff yet, so.
Right.
It could happen at the special meeting.
I was gonna say.
We can dovetail it in 2 weeks, or at the next regular meeting in May. So I just wanted to give you a heads up on
Yep,
that.
no, that's no,
Even
yeah,
if we had
sometimes,
it on the agenda, we couldn't probably do anything.
gotcha, yeah, sometimes it just depends on how the county likes to go through it. Cause it's subject to state's attorney approval, so sometimes you can approve it pending state's attorney approval, but it's fine with me, however you guys have to go about that process. It's not gonna slow us down, I can start the process and go through that,
Very
because
good.
it doesn't
I just wanted
cost
to
us
be
any money to
upfront
do that, so
with
I'm not
John,
really.
yeah.
I was going to say, that also gives us an opportunity to get it before the, public health board, before we vote on it, which, I mean, since they're a big player in it,
When do they meet again?
Next, third Wednesday of May.
oh, that's the next meeting, well, never
Well,
mind.
but we could still pass this document, they could be included.
We just had one, it's every other month,
That's every day.
So you got.
or every month, but it's.
But they're
third
gonna have to
Wednesday.
have
I
a
don't know.
presentation
They'll let me know.
to that
Right.
board,
Yeah,
so they understand it and they're on board with it and
Yeah.
everything.
That's my point.
So, Corey, just so I'm clear, the amount of cost you're expecting on this lease is gonna be in the range of 53,485 or less?
For like the annual,
Basically, the combined, you take these two, put them together, that's about what you're looking at.
yeah, so, and that gets set, it can get set up a number of different ways, it's most often either quarterly in arrears or semi-annually in arrears. So that's something that it's really up to you guys, but the financier will set it up on whatever's the most beneficial to reduce the amount of interest that's accrued.
So say, does that affect the costs?
well, the other thing we're up against is what the statutory limit we can borrow.
By way being a lease option and not
That's, yeah,
necessarily
I think that's why
borrowing.
they do it in that manner. Is that correct?
Correct, yeah,
Okay,
so it doesn't
all right.
affect your, if you were to go
I'm just-
get a bond next year, this is not gonna affect your ability to bond. So that's one of the other reasons why they set
I
it up
just
this way.
wanted to double check that,
Nope, that's a good question.
because we're talking about almost $800,000 plus.
Yeah, I mean, this resolution here has a do not exceed of just over $1 million.
Okay.
But that's prior to incentives, so once we take the incentives out, obviously, that's.
And how fast do we get the incentives and rebates?
So you will never see that.
I know, but
Well-
when are they taking off?
Oh, they're taking off right away, that's what I meant. That,
All right.
you don't actually have to worry about those
All
numbers.
right.
So yours is really the difference is what you have to worry about.
All right,
Because we guarantee the incentives and we'll go fill out the paperwork for that and deal with the pre and post inspections and all that crap that.
So how much variability is involved in this, or is there, a possibility that you would have to come back and say, hey, look, it's gonna be 20 years, vice 15, or it's gonna be more than X or Y, or how close are these numbers to what we can actually expect?
Pretty spot on. I mean,
Okay.
our tool is the same exact tool that the financier uses. The only thing that's gonna differ is usually the interest rate. But if the interest rate's a little bit higher than what we used, we'll probably just cut costs somewhere else and you guys won't see that difference. So we're usually pretty flexible with how we get that through.
And it's just Carl had some concerns, and I think those are valid, there is no scenario, as it exists right now with what we have toggled here, that there's gonna be an upfront payment or anything like that. It is all based on, starting, I assume, in 20, right, is when we start that payback, whether it's semi-annual or quarterly.
Yeah, it's usually 6 months to a year after closing of, or start of the project. So when you pass resolution to start the project, usually that clock will start ticking in a couple weeks, and then usually 6 months to a year after that, depending on what payment structure we go with. And that's something you guys can obviously weigh in on if you want.
Sure. And we have to do with our actual budgeting. As we
But it has to be
back.
budget neutral regardless. So typically we don't account for construction savings, construction period savings. So usually the construction period is 5 to 6 months. There's gonna be savings that is gained during that period, especially if we go do lighting early, go do some water and stuff in the jail. You're gonna gain some savings there, but we don't factor that into our budget neutral analysis.
Okay.
So that's just a pickup for you guys. So we like to make that as good as possible.
The second column where we're saving 28.2, that is not actual budget savings right off the bat that will help us pay that
Correct.
monthly
So that's
bill.
some maintenance savings, there's some equipment replacement savings.
So
things like
in
that.
order to make that good, we'd have to take that $90,000 we're budgeting every year and take that down by 30 grand. Do you understand that?
So, you know, that would just be something we'd wanna make sure that
Everybody
we're
was
on
aware
top
of.
of, and I mean, you know, historical
In other
numbers
words,
and things like that.
That's not a real savings other than you're not paying
That's
it out
not
to fix
happening.
that.
In other words, if we did nothing different than what we're doing right
Okay.
now, we'd have to increase the budget by 28 grand.
So they need to understand that that is part of what their payment will be,
Right.
basically.
It's not as simple as just being utility savings, there's some other savings, and,
Right.
and that's obviously things that you guys can discuss for sure, cause it doesn't need to be done that way, just a lot of that stuff will not be included in the project
Right.
if you can't. And you just, the way to look at it is, are we planning on doing this at some point? And would we rather spread that cost out over a period of time, or have to pay $300,000
Right.
in one swoop?
Just want
So,
you to understand that it's not a
It's not, it's a
total
good,
neutral. I mean, it's because those savings are over a longer period of time. These are actual savings,
Right.
25
Right.
to 85.
That's actual, and this is
This is,
anticipated savings.
Right.
actually.
Those are annual.
yeah, I know, the
Right.
28,
Yeah.
the 28 would have to come off the construction or maintenance budget in order to make it a true savings.
and that's what makes it operational expense savings, which is what the legislation requires. So that's, it's definitely a discussion that needs to be had.
Yeah, and I don't doubt that we would
How
probably
much
say.
was that, what?
The boiler,
I have no idea
yeah.
how much that was.
Do you remember?
Yeah, I'm sure we'll save more than that in the long run, it's just a matter of making.
No, I just, we just gotta all realize where the money is coming from.
Well, and that's more just deeper budget wise.
Did you have a question, Gary? Oh, I thought I saw this.
Couldn't trigger
The
I'm
Yeah,
trying to,
and to that point, it gets appropriated forward, so that's a requirement, obviously for you guys anyway.
And they've had problems
It's
with
just, that's something you definitely
Well,
want to
we-
see. And if you're shifting buckets, that's gonna be a bucket that you're gonna pull from, the maintenance expense. But
Well,
And the, what's on here is basically just to help, so one column taken out and placed in the back page.
Exactly.
These are everything on that actual Excel file that we were agreeing to.
Yep.
that we agreed to minus the,
The nose. So all the noses are taken out, just the yeses across the board.
Yeah, it was basically, the hot water at the jail was taken out and the expanding the VRF to the, which that's something that it might not make sense right now, but it's definitely
We left
something,
the hot water at the courthouse in,
correct.
which was one of those longer paybacks, but actually made a lot of sense.
So just putting bed stuff
because of
in.
the age of the.
It was venting into the building too.
any questions further? Okay, thanks, Ori.
Thank you guys. I don't know, I sent this over to Augie, I don't know if it had made it to the state's attorney
Yes.
into his inbox at
Yes.
least,
Oh,
okay.
yes,
So,
right away.
and he might ask, this agreement is the agreement with SmartWatt? Yeah, this is the resolution. That's the agreement with SmartWatt, and then, in addition to that, the final resolution will include the agreement with the financier, so that is not available yet, but as soon as we figure out who we wanna go with, I can get that over to him, so.
I would suggest maybe that we call Janet and maybe see if we can get a meeting, they can have a meeting next month so that we can scoop this up And.
I think it'd be
No,
possible.
and I
Yeah.
think as I recall that they went to 6 meetings unless something came up.
Mhm.
And
We have
I,
another thing too
please,
that I'll explain. Or you want me to explain it now?
Well, go ahead.
no, yeah, go ahead.
You're first.
Oh, wait,
Yeah, we're
oh, wait.
not, we're not done with our meeting here.
Oh,
We're
right,
just done
okay.
with Ori.
Okay.
Done
Okay.
with me, I'm out.
Did you have anything else today?
I-
Okay, now you're on, Dan.
Janet texted me on the weekend, and, we had talked about the, fiber optics. I think the health department go ahead on their own and set it up.
Okay,
And she gave the price, and we vote on the email because we don't have a meeting for another month, so forth. 3 of us voted yes to go ahead and do it. It's like $4,000 plus so much a month. Remember we talked about before and you said, well,
Yeah,
you
But
gotta,
that bid was,
it's not a bid.
determined, well,
She said, she checked on it and we can go ahead and do it for health department.
Just through a separate agency?
Right,
And the costs were comparable or
comparable, yes.
to what was bid?
Like 4,000 start and so much a month.
I mean, they're paying it all, right? She's paying it.
My
The only
concern
thing is that
I didn't quite
if it
understand
benefits
that.
us to tag on to that.
Yeah.
yeah, well, that's what we mentioned.
I know, I talked to you before, you talked about 4 different areas to do it, and you said it had to all be done at one time.
No, I
all
said
4.
we needed to check
Yeah.
to see if we could get a break and negotiate.
Well,
since
she's
we're
already
doing-
on
Okay.
her own, I guess, so.
We just
Did you might call Janet, or whoever's gonna call Janet to talk to her about that, to see if we can't, because we were also involving the highway
The highway
department.
department, are they
Yeah.
interested? Well,
Yeah.
they're interested
Yeah,
Yeah,
also.
you gotta talk to Josh.
She just put it on the website and asked for votes on it.
I understand that.
Did Josh put out, did he aggregate that first one he put together, the first bid we got from the